Awesome. Thank you so much. So thanks everybody for joining. We're so happy to have you here and happy to hear from Erin regarding her experience and how we can learn from and hear her story. So I'll go ahead and just start off and share. My name is Lisa. I'm a project manager for a company called Streetlight Digital. I just started with them about a month ago. Transitioned from a previous company with Deloitte. So very happy to be here and very happy to chat with Erin about her experience. So I will go ahead and ask Erin to just do a little introduction, share your name, what your company is now, what you do. So just kind of like a high level, if you wouldn't mind.
Awesome. Thanks. Thank you everybody for being here today. I'm Erin Ray. I am currently a Salesforce Health Cloud administrator for All4 Health.
Nice.
And just north of Austin, Texas, Central Texas.
Yes. I lived in Texas for a little bit, so I was like, all right, okay. Yeah, very cool. So I wanted to ask you, there's a handful, or not a handful, there's a number of questions we have, to be honest with you, to ask you about your experience and how your transition has gone. If anybody has questions during this time, feel free to drop them in the chat or save them to the end. And we'll have an open questions time at the end. So feel free to jot them down or drop those questions in the chat and we'll peruse through the chat to make sure that we get those questions answered at the end. So we'll go ahead and get started. I wanted to ask you, Erin, I have some questions down here on my table, so you'll see me looking down just a little bit. So I wanted to ask you, how did you get that job? How did you find it? How did you get that job?
So the head of HR, she actually reached out to me on LinkedIn. I think just recently gotten my Health Cloud accreditation, and I followed the hashtag Health Cloud topic on LinkedIn, and I still kind of go through and peruse any of the posts related to that. And I had seen a few Health Cloud positions. A lot of them were developer based, and I was, just click through things for the future to see, what path I might want to take. And I happened to see her profile, clicked on her profile, and I think she saw that I looked at her profile. And they were hiring for a Health Cloud admin. And so she reached out to me on LinkedIn, wanted to chat, and that, kind of went from there. I was real excited, when they told me about the position, because the mission of the company really means a lot to me. But yeah, all on LinkedIn, didn't apply or anything like that, just kind of fell in my lap. So
that's really cool. Wanted to ask you your job. So we're all here today because we have that commonality of healthcare. So what was your job before this admin position?
So I'm also a licensed nurse practitioner, and I was actually doing some utilization review work for Anthem, but before that I had worked for Optum as a nurse practitioner, and we were doing the after hours on call. That's actually where I got my more formal introduction into Salesforce, and kind of tell everybody that's like when the light bulb moment happened for me. I was like, this platform is really, really cool.
Oh, neat. Okay, so you used it with Optum?
I did.
Oh, very cool. So you had kind of like an end user experience there then?
I did, yes. And very much, Health Cloud, healthcare based.
Oh, very cool. Very cool. So if we were to kind of compare those two experiences, so like a day in the life of a nurse and then a day in the life of an admin, how do those compare? Like, do you have kind of like similar kind of day-to-day, like 8 to 5 or whatever the hours are? Do you have like autonomy? Did you have autonomy as a nurse? Do you have autonomy now as an admin? Like, how do those differ between your positions?
Yeah, so I would say a lot less stressful what I do now. I mean, I love my patients and loved patient-facing environments. But especially when I did the after hours on call, we were getting all the urgent calls and having to treat over the phone, communicating with the nurses at the facility. And so it was very high stress because you obviously wanted to take your best care of these patients. But, if they needed to go to the hospital, they did need to go to the hospital. So, like I said, a lot of very high stress environment. I learned so much there using Salesforce. But what I do now, even if I find myself like wanting to hop on the weekends because it doesn't stress me out. You know, I don't feel like, oh, I can't wait till the shift is done, because there isn't a, 15-hour stressful shift. I kind of ebbs and flows throughout the day with the time of how busy I am. So, sometimes I might be able to hop on Trailhead and figure out some things, or, Google and figure out some solutions to some things we're looking at. But it's really exciting. I will say, I feel like as a provider, you had to, a little different, but it's still a little bit similar with Salesforce's. You can get, obviously there's best practices. There's best practices in healthcare and there's best practices in Salesforce. But every use case is different. Every patient is different. So obviously we would have guidelines, but you would still have to, if the patient says, I understand, but I'll never take that medication, you have to figure something else out. You do have to kind of go back to the drawing board and meet that patient's need and figure things out to best meet the patient and their environment and what they need. You might say, hey, I want you to go do all these things, but if they don't have transportation and they can't drive there, it does them no good if you don't address these issues. Or if they can't afford the medication, you have to look at alternate ways of getting that medication, or maybe alternate medications for that patient. So I feel like those problem solving skills are, you can use them. They're similar in Salesforce, that there might be items that you might not find the answer strictly on Google or on the help docs or on Trailhead, but you might find some helpful things that help you solve the problem that meets the need of your client or the company you work for. So I feel like those things do translate. Kind of a day in the life. I didn't necessarily have always an 8 to 5 as a provider, because before I worked for Optum, I worked in the skilled nursing facilities.
Okay.
So you were kind of in a way always on with, you were on call, or I would get up really early in the morning to open all my charts, check labs, see if I had any notes left online to me by the nurses overnight. And then you would get in and you go see your patients, and you might address some urgent concerns, follow up. But sometimes my day didn't end till 11 p.m. at night because I was catching up on charts. So now, like I said, I find myself sometimes, if I want to hop on in the weekend or I want to hop on in the evenings to learn more, it's not stressful, but it's more because I want to do that. My company's not, obviously not having me hop on in the evening to, try to figure out a scenario. I imagine if, once we're a little bit more up and running with our health cloud implementation, sometimes we'll have some providers that work on Saturdays. If there's ever, some support that they need, I'll be there for them though. Cause, I went from sometimes putting in 65-hour, 70-hour work weeks. So this is, like I said, much less stressful. So to have to work outside normal working hours sometimes does not bother me, but definitely not the typical in the Salesforce world for me, in my experience.
Nice. So it sounds like you went from more hours to less hours, more stress to less stress.
Definitely.
Turn over to the Salesforce ecosystem.
Definitely.
Awesome.
Yes.
So just a few housekeeping things. I see that we're having more people join. Awesome. Thank you so much for joining. So we're asking Erin some questions right now. And if you have questions while we're going through this, feel free to drop them in the chat or hold them until the end, and we'll have an open time to ask her some questions. So thanks for joining. So Erin, you hit on a couple more of my questions that I have on my paper with that comment. Oh my gosh. So let's see. We did the day-to-day, typical day. I wanted to ask you, so you mentioned that you started learning about Salesforce through your previous job as an end user. What made you want to transition to that? I mean, I've used a platform before in a job and not necessarily thought, hey, this is great, let me actually learn more about it and kind of specialize in it. What was something that kind of drove you to thinking a little differently about it and seeing it as an opportunity to pivot into that ecosystem?
Yeah, so kind of for me, I was always driven to a little bit more of the tech side of healthcare, especially with our EMR stuff training. I did some some code chart auditing of our ICD-10 coding and our charting system, things like that. but I saw with that, I would be communicating with our providers like, hey, we need this for CMS guidelines. And it was stressful, a little bit cumbersome. Sometimes you didn't know what to chart until somebody had to sit down and really teach you, and you weren't taught that in, PA or NP school. So then when I went to Optum, we had to make quick decisions. We had very sick patients, and the ability to find a patient so quickly when you were covering 5-6 different states, to find them at that nursing facility, open up their chart, and you had, I know we like to say this 360-degree view of this patient. So I could see their medications, I could see their last visit, I could see who their PCP is in the facility. I could see, who makes maybe their POA, who makes their medical decisions. But I could see it really quickly. And so it didn't slow down our care. It helped us. Whereas in an environment where I was before, when you weren't in an urgent scenario, it still took forever. So I feel like there was sometimes delays because we didn't, our systems didn't communicate to each other. So that's, to me, kind of really what, like I said, was the light bulb moment for me. Like, what is this platform? I had always thought Salesforce was sales. So that was really incredible for me to see it that way. And then, I had a friend locally that she actually works for Epic, but I told her, like, how do you break into this world? And she just encouraged me. She said they had pharmacists and they had physicians that were kind of like the liaison and the bridge between maybe some of the software engineers and the clinical team. And I thought that was really cool to be able to speak to the clinical team's needs, but be able to speak to the tech team as well, and kind of meet in the middle, or at least have a good communication and not have separate systems that, if the tech team says we need to go this way and the clinical team, we all know, being a healthcare worker, when stuff doesn't work for you, how stressful that is. So that was kind of just the light bulb moment for me. And that's how I took that route. And then I saw the Choose 5 podcast.
Okay.
Yeah, that was kind of like the final. I had been looking, and that was where I was like, oh, I can actually go get a certification in this and learn about this. And I've followed Choose 5 for, I don't know, probably since like 2017, 2018, but I don't think it was like till 2020 when I found out about it.
So, that's really interesting.
Salesforce.
Yeah, that's really interesting to kind of like want to be that person to go between. So you speak healthcare and you also speak tech. So you have like that merge of both things that you like.
Yes. And I kind of sidebar, like, I feel like that's really important for the healthcare, just like the disruption in healthcare and going forward, is, healthcare providers, we need to have a seat at the table for the technology that's being built. Because yes, we may not be the software and, the developer or the engineer, but we know in the field and the boots on the ground what the clinical team needs, and what we've been missing. And then when there is disruption, and we're like, wow, this platform is really cool, it's different than anything I've ever used, this is incredible, like, you can really speak to if it will work in the field. So
it's very true. To kind of pivot back to a day in the life. So if you could tell us, what does your day look like now? Like, when you go into the office, do you go into the office? Are you remote? Are you in person? Are you hybrid? Do you start your day with a certain routine? Is it kind of like you go in there, you don't really know what to expect, and you just like hang on for the ride? I know some jobs have a pretty set schedule, and some of them can just be, you go in with a plan and you end up doing something totally different. So can you kind of just break it down for us a little bit with what your normal day looks like now that you're a Salesforce admin, just to kind of give folks an idea of what it could be like?
Yeah, definitely. So the company I'm working for is a startup. So a lot of like new things, growing things, a lot of, forward momentum, which excites me. I love to learn something new every day anyways, and not have the same day in and day out. So I'm fully remote. I will have some travel to the headquarters. I think it was my second week with the company. I did go to Columbus, Ohio for a week, just kind of meet the team. And then we had workshops. So this is a big part of my day every day right now, because we are having a big build being done by a consulting firm to continue to build out our health cloud platform. We had workshops when I went up there to headquarters. So right now I'm kind of doing like some of the project management, making sure the different individuals that need to be on the calls or the stand-up or the demos and the sprints are all involved, communicating with the team members daily, depending on kind of what's going on for the week. When we get some of like this week, when we get some of the process flows, making sure it looks good for our team that's actually going to be using the product. So a lot of that daily is, communicating back and forth, some of that project management meeting with, different stakeholders or some of the clinical team. So, different sides, we have some kind of different routes with what we call different service lines. So some of our teammates overlap to we're on the same calls and some don't. So I might meet one-on-one with some individuals to kind of get them running in the Sales Cloud environment, maybe the recruiting team. I've been doing some training with them as well. So, some days I have like maybe 1 or 2 hours of training with a group, and then maybe some one-on-ones to get some more detailed training with the rest of our team, and then kind of, following up with our the implementation of our Health Cloud org and the build, and, making sure if the consulting team needs anything, following up with them. We do have what I love. It's 8:45 my time. We have a stand up with our developer team because we do have an in-house developer team, which I think is really amazing. And so really with them, I'm not communicating, they know kind of what's going on with the Salesforce project. To me, it's just, so I just kind of tell them what's going to be going on with my day. But what's exciting to me is kind of seeing their process and how their sprints work, how their progress works. So I've just learned a lot from them in that regard. And then we have another stand up with some other members of the team, my boss and some of the teammates. I love that. I haven't, in healthcare, I haven't really been able to do that. So it's very useful for me. I love the communication. Instead of like bothering my boss all day long, I can just give him some updates. And if he needs to tell me anything or get me on track for something, or give me something to look down or to kind of study up on, or something to manage for the day or to figure out for the day, I get that information then. And I love that it's in the morning. You can get some things started before and then have your meetings and kind of, I don't know, it's like exciting. It's like momentum for the rest of my day. So I feel like that one I kind of rambled on, but it's different every day.
I know. I have a couple follow-up questions for you too, because I'm trying to set myself in the shoes before, before Salesforce job. So I heard you say workshop. What is a workshop and how long do those usually last? And is that something that's done daily?
Oh, so that was actually, we got the consulting company building our org. They actually ran the workshops for the most part. Okay. It was more like a requirements gathering. Gotcha. Yeah. So we all flew to the same, to the headquarters and all got to meet daily. Yeah.
So you went there to talk about what you needed for your implementation and for your updates and all that kind of stuff.
Yes. And so really it was most of the, it was the rest of the team and, kind of the different segments telling the consulting from what we needed. And a lot of it, I was just a fly on the wall because I was 2 weeks in learning about their processes, but it was really awesome for me to see that because they were having to do deep dives into how their process works and what it looks like.
Yeah, that would be a really neat session to be in. So I do have a couple other questions. So I heard you say the words sprint and stand up and things like that. So that sounds like you're talking about Agile, correct?
Yes, and I'm still learning about Agile. So yes.
So did you work in like Agile methodologies previously, or this is your first job where you kind of picked it up and like heard about it and are kind of diving into it?
So I mean, I've heard about it, read some on it, just like a little bit in Trailhead and seeing it posted like on LinkedIn and our Salesforce groups and our community groups. But this is the first job that I've been able to see some of it in action. And actually quite a bit of it in action and in this using the sprint planning and the different stand-ups and phases and I'm still learning a lot about it. That's kind of on my list of more things I want to learn about. One of the things that really attracted me to the company after I interviewed was, like I said, they have a developer team. They have not only a wonderful clinical team, great leadership, but they have a really amazing tech team. My boss, the CIO, just hearing him talk during our interview and the questions he asked, I felt like, wow, I will learn so much from this team and from this company, and I can grow with this company in not just, learning more about the healthcare aspect, but the tech side. And so that's something like I want to keep learning, because I know it's definitely it's utilized at our company.
Yeah. So it sounds like you were also interviewing the people who were interviewing you to see if you would want to work for them, right?
Yes. I first interviewed with the HR head of HR, and I had questions. I always tell people, like, always have some questions, but I just had a really good feeling about the culture and how they treated their employees. And then the same with when I talked to the CIO, and it was just like for me, it was a wonderful interview, because I felt like I was able to pick his brain and learn and like you said, kind of interview not only just their culture, but how can I continue to be an asset to your team and grow and learn.
Mm-hmm, mm-hmm. How would you describe your interview process? Did you have multiple interviews? Did you have a technical, a behavioral? Did you have just one or a couple interviews? What was that like?
So I had a few interviews. It was just about 2 interviews. I would say probably, it was definitely some technical questions, but not like, open up an org and show me things. And,
Okay.
but, definitely some questions around, like the fire standard, data models. I think some of it, we just started talking about Health Cloud and the opportunities with Health Cloud. And I just kind of spoke to, what I knew and about the best practices and the data models and what things look like from what I've learned and with Health Cloud and in the implementations I've done with Health Cloud. Because I actually was a short period of time at a consulting firm right before this one. So I was able to do some implementations for some projects. And so just kind of speaking to what I knew, and then questions back and forth. And really, it kind of became, real like conversational, where you could talk back and forth, like I said, about, the data model and best practices and things like that. So definitely it was, I'm always nervous going into interviews like today, even. I feel like I'm not that wonderful, like, why me? But it was I felt like both interviews, it just became this like really good conversation about where the company's going and what they do and their mission, and then the technology that they're using, and the, Health Cloud data models and things like that. So it became so much less stressful, where I was able to relax and just kind of speak to what I knew.
So the previous experience with the other job really kind of gave you some confidence to speak in those technical languages.
Yes, it was very, very helpful. They're a wonderful company too. I loved being there, and I didn't even anticipate leaving. I just loved this company that reached out to me. It was just kind of a, I always wanted to go down into, becoming Health Cloud kind of in-house. But yes, definitely helped me speak to the tech side of it, doing some of the implementations. I ran some of our smaller projects and was able to be one-on-one with clients. So it definitely was a confidence builder for me to be able to do that, running demos and kind of walking through the process and doing training and, all that that we love to do. Is like, I love to build, I love to meet with clients, I love to talk to them one-on-one. So I feel like as a healthcare provider, you are used to being patient facing. So it's nice to be client facing too as well. So I learned a lot about that aspect in that previous position.
That's a good point. Let's jump to what your first 30 to 60 days were like in your first job with Salesforce. So when you started your first Salesforce job, like 30 days in, 60 days in, 90, like, was it what you expected? Was there a learning curve? Was it uncomfortable? Because you might not know answers to things. So could you kind of tell us what your experience was, either in any of those durations, um, to just kind of help people know maybe what to expect, maybe what it might feel like in the future for them?
Yeah. So when I was at the consulting firm, probably within the first 2 weeks, the first week it was a lot of shadowing. First 2 weeks, a lot of shadowing, some of the client meetings, the projects. Then I was able to shadow some of the build time, kind of
Mhm.
hear the client meeting, and then see their thought process on what they were building, and then watch them build and talk through that. And then I think it was probably by my third week, I was able to kind of start running some of the meetings with
Very
somebody.
good. Nice.
With somebody shadowing me. I was so nervous. I felt, but it was a healthcare client, and it was full of nurses.
Nice.
So I loved that they were so understanding, and then the person shadowing me, he's incredible, such a great teacher, a wealth of knowledge. So I knew that one, they were very encouraging to us that if you don't know the answer, it's okay. You can, and we had to do that in healthcare too when you're treating patients, especially when I worked in the SNFs. Like, you had time to, okay, let me go figure out what will be the best plan for this patient.
Mhm.
So that was similar. It's okay to say, you know what, I'm going to have to look into that
Yeah.
for you, because you don't want to constantly be trying to give solutions without really being able to digest and deep dive into their process. So that was something I learned. And if it was something that we could answer maybe a little bit more quickly, and I was like, you know what, I don't know, I'll have to find out. I knew I had my teammate there shadowing me, that sometimes he'd pop in and be like, I know she'll figure this out, but if you just need this quick answer, this is what this is. So it was good to have that support there. He was basically on all my calls with that client all the way through, from implementation to all the way through to go live of the complete project. So that one, I think I had that one probably done. They were these smaller, we call jumpstart programs.
Okay.
And so that one, I think we were done probably about 2.5, 3 months in. I was able to get some additional work and do some a little bit, more advanced building with them. So that was pretty neat to be able to follow through with that. And so I would say by about 30 days, I had not many, but a few clients that were mine. And then still shadowing some other teammates and learning about more, Sales Cloud implementations, while I was also studying for my Health Cloud accreditation and learning more about that. So they were very encouraging to continue to learn. Obviously, if there was maybe a scenario or a solution we needed to come up with, any training or learning we did on Trailhead, that was not only just like for our client, but that was continuing to build up the company and ourselves as well, and our knowledge. So very much encouraging of that. I think by 60 days, I had a few clients where I was, just running the meetings myself and had a good rapport with the clients if I needed some support. With,
how comfortable were you with that at that point? Like 60 days in, you're running it. How comfortable were you? Were you kind of like, I think I'm getting this, I'm great. It's great that I have these people to help me out. Or were you like, yeah, I really got this. I know what's going on.
I would say, depending on the client, sometimes, because some clients, it was a little bit more straightforward. Some clients, they had some interesting needs, some processes that you're still trying to figure out. So I had some where it was so nice. And like, I had a lot of healthcare clients, and those weren't necessarily Health Cloud, but I don't know, that it was just easy and smooth. And I was like, oh, I got this. Like, their use is going to be like, I'll be able to get this done and, deliver a good product. And I always want to deliver a good product on my complicated cases, but those are the ones I'd be like, I need to meet with you, because I need to talk this through to see if my train of thought is really what you would do in this scenario. So I would definitely say there was both. There were some of them I was like, oh, I got this. Some of them I was still a little bit apprehensive. So I would always do like reading the night before, then maybe like the day before meet with some of my colleagues. Obviously we had a lot that had a lot more experience than I did. So meeting with them to make sure I would, at least on the meeting, have the confidence to be able to speak to what we were doing, and then be able to do some more requirements gathering, things like that. So yeah, I would say it was both. By 60 days, there, it was, dependent on
Mhm.
the client and what their needs were. So
Awesome. So it sounds like the ability to prepare before those meetings was pretty key to giving you some confidence that you needed to have while you were in those meetings, right?
definitely, yes.
Mhm.
So definitely a lot of reading, a lot of Trailhead help doc. I mean, Trailhead, a lot of help docs,
Mhm.
and that just was good for my learning to be able to like put it to practice. When you're learning in Trailhead, it's wonderful. It's amazing that Salesforce has that, to be able to learn, but it's like clinicals versus being able to actually put it into practice. So yeah, it was definitely the difference for me. Just feeling prepared was what would help me, communicate with my clients. I felt intellectually challenged, and I felt like I could intellectually speak to what they were asking. So
Nice. Nice. What would you say were some of the skills, soft skills that you had that you took from healthcare and were able to pivot over to Salesforce and say, hey, these are things I already have and they play really well as being either like a consultant or an admin? What were some things, like you mentioned problem solving earlier? So something kind of like along that lines, like what were some things that you brought to the table that were very valuable that weren't like necessarily Salesforce, like lingo or language?
yeah, no, definitely. I felt like in the beginning, when I was, even before I was certified, I was doing interviews, and I wasn't even halfway probably through Trailhead by somebody reach out to me, and it was an interview, but it was also, a learning process, and they knew I was still very early. And so I asked them questions. I was like, for somebody like me, what would you recommend? Because they had a healthcare background, 15 years ago, or 10 years ago, and they had been in Salesforce consulting for quite some time. And they had told me, focused on, again, those soft skills,
Mhm.
focus on the core clouds of Salesforce. But they were like, think about what you did when you were in your healthcare position. So just gave me a lot of good advice to kind of dive deep to be able to answer things like this. So I figured out with consulting, for me, what I thought was, when I worked in the nursing facilities, or the hospital, I would go in and I would communicate with the nursing administrator, the
Mhm.
DON. I also knew that sorry, I just somebody come in our room. I knew our CNAs or our med techs. They were our eyes and ears to our patients too. So I knew that I had to develop a relationship with everybody in that facility, and that it was important that they felt comfortable coming to me,
Mhm.
that they weren't scared to come to me, because that was the way that we would give the best care to our patient. To have that, we've probably all seen this, that provider or that nurse that somebody's scared to bring up a problem to, that doesn't benefit anyone. And it certainly never benefited our patients.
Mhm.
So I felt like the best thing is to develop those quality relationships. Sometimes, maybe just hanging out at the nurses station and getting to know some of the nurses that maybe I didn't see as often, or the med techs or the CNAs. And I felt like sometimes they would be like, oh, like, Miss Erin, like, thanks for asking about my day, and so it made them feel appreciated, because they were very much appreciated. They have a very hard job.
Mhm.
So understanding the jobs that they do, trying to, connect more with everybody in the facility,
Mhm.
I feel like can transfer into consulting. You have so many different clients that you're not just talking to just your key leadership at that company. That leadership is asking all levels of employees at that company about, hey, let's talk about our business process and how we can help you build this product
Mhm.
within Salesforce. So being able to translate that into consulting and be able to have those relationships. So I feel like any of those soft skills with building relationships with all different levels of employees, all different personalities, and be able to relate and communicate to others, is huge. And same thing with, we develop those relationships with patients. We might have different personalities. Some clients are, like I said, some projects are very easy. Some are more difficult.
Mhm.
Some projects you have more, more employees or more individuals on their team that are going to speak to what their needs are. So you have multiple different personalities. So being able to, like I said, relate to those personalities, relate to others. In healthcare, we listen a lot. So I had to learn that as a nurse and a provider, that if you don't stop and listen, you might not hear what's really going on with your patient,
Mhm.
or your patient's family. Or you can bark at them all you want, but if they don't have a car to go pick up their medication because you didn't listen to what they were telling you, they will not meet their healthcare goals, or even just have good care. So I feel like in consulting that translates as well. Same thing with being an admin. We have all different teams. We have clinical team, we have a recruiting team, we have a sales team, we have a tech team. So there's a lot of different personalities. There's folks with a lot of different backgrounds
Mhm.
of where their experiences are coming from. We all are going to sometimes react to things based off our experience, or based off our job of what we feel like is most important and what we need. And if you make somebody feel like they're not heard or not important, and then we build this product without hearing them, and it's meant for them, that does no good. So I feel like a lot of those skills of listening, problem solving, being able to relate to others, caring about your client or your teammates, that really translates into Salesforce. On that first interview, where it was kind of like a learning interview as well, he told me, he said, I've got people that have 7 certs and they're very technical, but they can't have a conversation and they can't talk to anybody and they can't ask questions the way somebody with soft skills does. And he said that you can't train that. You can a lot of people, maybe not when I'm 100 years old, I might not be able to learn all these technical skills. But a lot of we can learn those technical skills. So don't discredit your soft skills that you have in healthcare. You'll be able to learn the technical side and we'll continue to grow. We do that in healthcare. We learn and we continue to grow. We never stop learning in healthcare. You always have to be abreast of the best practices. So a lot of different skills, I feel like, translate.
I feel like you just dropped some gold right there. Like, you could get a ton of certs, but that communication piece, that ability to relate to people is huge. So that's a very powerful skill set to bring into an interview. So thank you for sharing that.
Thank you.
Yeah.
I'm glad. Like I said, I'm always like, why me? I'm not that special, but I'm glad to be of help in some way.
And I'll debunk that right now. So I can probably speak for like some of the folks here on the call, where it's really nice to hear how you're able to merge both of the areas, the healthcare into the Salesforce, and how you're able to have that passion for both of those, and how you've been successful. Seeing somebody who has been successful, gotten a job, gotten 2 jobs, and is in the ecosystem, and seeing that from the perspective of somebody who's sludging through Trailhead, right? Just trying to get it. It's encouraging. Like this is really great to be able to hear your story and to be able to hear like your perspective and your success. And that's why, I mean,
Thank you.
Very cool. Very cool. So I have a few more questions. We're about 45 minutes in, so I'd like to leave a little bit of time for some questions and answers at the end. Lori, I don't know if I haven't been really keeping track of the chat, but if we want to like peruse through there to see if there's any questions to ask Erin at the end, that'd be great. I'll have a couple. Thanks. I have a couple more questions to ask you here, Erin. Kind of like to compare again, like healthcare to Salesforce. So you mentioned the difference in like the work hours and like in your perspective of your jobs with those 2 industries. What about the work culture? So if you were to compare like the culture of when you were working with the healthcare positions versus the Salesforce positions, is it notable, or were they pretty similar when it came to like the work culture?
Yeah. So I was one of those in healthcare that I was just always fortunate that I had amazing bosses. Always had like really good working relationships with my colleagues, or other parts of the team. But, I had friends that, and still do in healthcare that don't have that experience. So I will say, like, for me, I've had good experiences both in the Salesforce world, have already had amazing bosses, amazing teammates. I have lifelong friendships from healthcare, and all my positions in doing that. And, I do see the culture being, at least from what I've seen in the Salesforce world, you're not so, and maybe it's just the size of the companies, I don't know, you're not so disjointed from leadership in the Salesforce world. So I do feel like in both my positions, your leadership does want to hear what you have to say. And, I know it's a little different when you're in a hospital and your big hospital system, maybe your, hospital administrator doesn't have time to always come to the floor and, inpatient side. I did work for the VA as an inpatient nurse. So obviously that's a large system. So, sometimes the nursing pizza parties weren't always, you're glad to get some pizza, but, it'd be nice to get more staffing. I'm sure we all know about that in the healthcare world. But I always still felt like in the healthcare world, I had bosses that, would at least tell me like, hey, I know, they would explain why, like, we're on a hiring freeze. I'm sorry, but like, I'm here, we're going to work together. So sometimes it's just good to know that you understand, like, there's an obstacle to maybe why they can't have more staff, but at least they're honest with you. I've had the same, I feel like, with my bosses in the Salesforce world, and not that we've had a staffing issue, but I'm sure I'll experience at some point being in a company longer, there's turnover because there's a lot of people being pulled away in the tech world and a high need. I feel like the support is there, though. They're open and honest and encouraging and uplifting. I do see a little bit more of that supportive culture in the Salesforce world, in the whole organization as a whole. Whereas like in the healthcare world, it was more kind of like my teammates and my direct boss. I feel like in the company I'm now, like if I want to go to the CEO, if I needed to, like, he's there. He's even reached out like, hey, I just want to make sure that you have everything you need. We're here for you. So that to me speaks a lot to the leadership at the current company I'm at, and the culture that you can talk to any part of the team. So
that's wonderful. That's great to hear those experiences in both industries, to be honest with you. That's really great. Let me see. Okay, here is something. So I have two questions. What do you like most about your job? What do you like least about your job?
So I like, there's a lot of things I like most. I will say, like I said, the mission of the company, we work with a lot of the Medicaid population, increasing access to care. That is why I really wanted to get into the Salesforce world with healthcare, into the ecosystem to I feel like there's a lot of disruption in healthcare, and I want to be part of solving that problem. I love that. And I love that we get to problem solve and meet patients where they are, where their needs are. There needs to be a lot that changes in the healthcare world to be able to meet our patients' needs and continue to have happy clinical teams, because we're tired. I was tired and burned out. And, we want to continue to keep that wealth of knowledge in the healthcare world, so we can meet the patient's needs. I love being remote, but so this is what I probably like the least. I sometimes miss that team environment, because when I was there in Columbus, I had so much fun getting to learn and meet, all the different members of the team. And when we do stand up, like, they're funny and they're fun to talk to. And, sometimes it would be nice to have some of that in office culture, but I do love being remote. So I hate to say that's what I, I don't know. Maybe it's because we've been COVID at home for so long. I do miss some of that one-on-one or that face-to-face office culture interaction.
Yeah, that's a really good point. I'll just share a tiny tidbit here. Like, with my previous job versus the one I have now, they're both remote. My previous job, we barely ever turned on our cameras. This job, every time we talk to somebody, we turn on our camera. It makes a world of difference. So I would encourage folks if you have a remote job, turn on the camera, have that interaction, have that, that visibility there, because it really, really helps. So
I would agree with that. Now that you say that, I was like, oh yeah, we have our cameras on.
yeah.
So it does make a
Okay, I
difference.
have my
That's
camera
probably why
on.
I have fun talking to them. Hey, Lori. Didn't mean to call you out there, Lori.
I didn't mean to call folks out here. I just meant for work.
Yeah, just we're not working.
Yeah. So those were kind of like my actually I have one more kind of like advice. So some people here might not have broken into the Salesforce ecosystem yet, and they might be looking for some tidbits of advice. What are some things that you might share as like a learning experience of things you've learned along the way that have helped, or things you wish you would have known, breaking into the ecosystem? What helped you break into the ecosystem? Maybe something with LinkedIn.
Yeah, that's a good question. I'm sure we have some talent stackers here. So I feel like that the Talent Stacker Career Development Program really helped me because I was able, you have a guided path of how you build that network. And not just that, is Lori, when I joined, she reached out to me, and I'm probably tear up again. She reached out to me, and she was the most supportive person I have ever met. And I was like, well, where do I even go to start and things like that? And she gave me so much guidance that I was like, wow, like this is crazy. Like the people, I didn't think, I was like, surely this is one-off. And Lori, you're still like, so there's only one like you, Lori, and you're incredible. And there were so many more people that were willing to help. So, and learning, like continue, like people send me links and, hey, I know you love Health Cloud. Why don't you look at this webinar? So I feel like being part of the Talent Stacker network was for me kind of like the golden path of how do I break into this ecosystem? Not that you can't do it without them. I don't want to discourage people that maybe can't take that path. It still certainly can be done. So without talent stackers, I would say definitely network. Continue to learn every day. I see a lot of people like just post about every day or multiple times a week what they're learning. And I learn things by reading those posts on LinkedIn about, oh, that's cool. I didn't know about that. Let me go look at that part of Salesforce. So that was probably for me one of the biggest things in transitioning. And then when Lori made this group, the Healthcare Heroes group, I was like, oh wow. I think I met like another NP who transitioned, Shelly, Jade. I reached out to Jade because I just loved her story, and she hopped on a call with me to like help prepare me for my first interview and just for me to ask questions. And she was just so supportive. Again, like so many incredible people that are very uplifting.
Jade is awesome.
She's another one that's just like,
but she does not want us to shout about how awesome she is.
No, but
she wants awesome. Low profile.
She's so awesome. Yeah. And so are you, Lori. I will say that there's nobody like you.
Well, thank you. I'm glad some people find me helpful. So we do have several questions here. Are you done with your questions?
Yeah, let's do it. Let's go.
So Taekwon was asking, what advice would you give to a professional who has no formal experience in the technology industry, but would like to be a part of the Salesforce ecosystem?
Yeah, I would say kind of back to the last answer. I had worked, obviously we charted online and I did online chart audits, but that was still all in healthcare. I helped sometimes with the technology or kind of was sometimes I felt like IT support on some of my teams, but it was not a formal tech position. I was always in nursing or as an NP. So definitely network on LinkedIn, reach out to groups like Lori's group. If you want to look into Talent Stacker, that certainly helped me. So things like that, just, but the biggest thing is network, see what other people are doing that have similar backgrounds like we're doing today, see how they broke into the ecosystem. And that was the biggest help for me.
And I would also want to add, just jump into the org and play. Don't be afraid. Don't be afraid to break things. It's the best way to learn the platform and utilize your background, whatever you had in your background. Utilize that. Know that there are several industries that use Salesforce ecosystem. So you don't have to be just an admin. You can be any of those that you know how in Salesforce website itself, there's that path, career paths.
Yes.
So it's basically that. If you would lean onto your background, there's plenty of industry related roles that you can land in. So focus on those two. Like finance, health cloud is just one of them. One company was calling them verticals, health cloud, finance, education, maybe real estate, just use those. And if you have some ideas how to apply the concepts that you learn in Salesforce platform, and then just kind of try to build even just a simple app that relates to that, then do it. It's a good way to demonstrate how you can actually help the business using Salesforce.
I love that advice because I think one thing about being a nurse is that, you're always going to be a nurse. And one thing is you want to have an impact on other people. And I just want to be able to have that same impact from the bedside and apply that into a Salesforce career.
Yes, and when you get to the point that you're being interviewed by companies, a lot of them focus on why Salesforce, right? And you gotta say something to the effect of, because you want to help the businesses, because when you help the businesses, you're helping the customers, which are essentially the people. Okay, another question by Candice. A big part of why I entered healthcare was to fulfill my passion for helping others. I know that's pretty common for a lot of us, but do you feel like you're still able to achieve that through your admin roles thus far?
Yeah, that's a really good question. And I kind of tied back into my thoughts on the last discussion. Like mentioned, you want to help people as healthcare providers or as healthcare workers. I feel like the nursing profession, we're called the caring profession. We care and we want to affect change and we want to help others. I still feel like I'm able to do that. And that's one of the big reasons of why Salesforce. I'm very passionate in the changes that I saw when the pandemic hit and how we were able to not only meet the patient's needs when they couldn't come to the office or the clinic, but how much disruption happened, how many companies came out with ways to be able to do that. So to me, I'm really passionate about the change that healthcare is undergoing right now. That was one of the biggest reasons of coming to the company I'm at now. I am very passionate about the Medicaid population. And again, being able to meet them where they need providers to come, or they need care to come to them, or they need, they need increased access to care. So I definitely feel like in a way I'm able to maybe help more, because by being able to work for this company in this manner, I'm affecting the lives of many, many patients every day across all our clinical team is serving so many, children in the Medicaid population and adults too, but primarily a lot of kids. And to me, that's a big deal in my heart to be able to meet the needs of that population. And so I'm able to help all those clinical teams meet the needs of those kids. So in a way, I miss that one-on-one with the patient, but I feel like I'm helping a lot more in a way. And that's very fulfilling to me.
So that answered Wendell's question, actually. Okay, Bill has a question and this is to anyone, what are some best practices to find companies that use Salesforce beyond traditional job search sites? He tried keyword searches like uses Salesforce with limited results.
Oh, good question. I'm sure Lori will probably have a lot more to this, but I saw Justin and the talent stackers mention like, don't search Salesforce, search CRM. And I remember going in and doing that, and just to see, like, I was like, I'm curious if that works. It does, because a lot of those job postings just say like CRM, but they want Salesforce experience. So they're not putting it in the title. Even in the job description, there's not much about Salesforce, but if you look at what they're using Salesforce. Not every posting, but that's another way to look at it. That was kind of my tidbit to kind of look at it differently. LinkedIn has a lot as well. What I'm sure, Laura, you probably have some advice on that.
Well, I did say something about going to App Exchange, but he's looking more onto being the end user kind of role. And I'm not sure if Bill, do you also kind of look, are you looking at something like being an admin?
I'm
Not
looking
just-
at a variety of different things. Certainly admin is a possibility, but I also would like to utilize customer service experience as well. And I know there's Service Cloud, but just trying to widen the net as large as possible. I know the go-to is being an admin or business analyst. I get that, but there's multiple ways to enter. And so that's
Yeah.
why I asked the question.
Have you tried joining some Trailblazer community groups? Because there is a group for marketing and
Yes, I
customer
have done that.
success.
Now lately, I'm looking probably more inclined for a remote position as opposed to one that is, let's say, geographically based. And so, again, I wanted to widen my net. So
Another keyword that you might also want to try using is actually just SFDC. I remember reading about that too. Salesforce, what was it? Salesforce develop.com. That's something like that. Yeah. So just
Or like
type in SFDC.
search the cloud, like
Yeah.
the cloud names
Mhm.
too, Service Cloud. Sales
Right.
Cloud.
Yeah. I really can't think of anything else aside from those. But yeah, if for those who are looking into consulting, one trick is to go to the App Exchange and look for the consultants tab. You will see a list of companies there that do consulting. So the positions in those some of those companies actually provide training for almost like, I don't know if you're familiar with Deloitte. They have training, and our company also, we have training for entry level. So those partners usually would have to that's all I can share about that.
Well, those are good resources to share, Lori. Thank you. So I see another question down here. I know we're at time. Do we have a few more minutes for some more questions here, Erin? Do you have a few more minutes?
Yeah, definitely.
Okay, great. So it looks like Stacy has a question. She's wondering if you found that companies had a specific interest in your nursing background beyond soft skills. Were they looking for a nurse?
Yeah, so the first company that reached out to me, the consulting company I went to work for, they were looking for individuals with our healthcare background. And I know they've since hired, even when I came on, they were still looking for more folks. I referred a nurse who, she's amazing. She's multiples certified, but also has an extensive informatics background. And so they were really thrilled to have somebody like her on board with her nursing background. And it wasn't just nursing. They were looking for individuals with clinical background because they were, we had a lot of healthcare clients. We're continuing with some more health cloud projects. So definitely something they were looking for. And I know you mentioned like Service Cloud on the prior question. They were looking for individuals with backgrounds in those, different industries to align with the different verticals. So don't discredit your previous experience because they are interested in folks with our background.
Nice. So Laura, it looks like we have 2 more questions. So one is yours. Yeah, asking if Erin replaced someone, and if you did, how long that previous healthcare admin stayed, and the reason for leaving.
So I did not replace anyone. This is their first, the company I'm at with now, it's their first Salesforce hire. So
Oh,
it's been kind of exciting to get in there as they roll out the projects that they've had and then continue to build on the projects. So yeah, I'm really excited to just grow with this company because they are doing a lot of amazing things. And kind of talking with the last question, I know they seem like they were interested, this company as well, in my background, because you can you can be an advocate for the clinical team in addition to the tech team. So
nice. Very cool. All right, so last question we have, let's see here. From Sarah, she's wondering, while you're interviewing for your first Salesforce position, so before you'd made the pivot, were you ever asked why you were leaving the bedside in healthcare?
I don't know if I necessarily directly was. I think it was kind of like the why Salesforce question, what made you transition? But I was never like directly asked why I was leaving bedside. At that point, I wasn't necessarily at bedside. I had been remote for, I don't know, maybe 2 years at that point.
Oh,
yeah. So I think it was kind of relayed a little bit in like my why Salesforce. It's like I was always drawn to the tech side and in that regard. So yeah, I didn't really get that question directly.
interesting. That's great. Well, Erin, we are at the end of our time with you. So thank you so much for sharing your experience and your advice and everything that you've shared with us tonight. We really appreciate your time. Thanks for answering all these questions and for Lori setting this up in this group.
Yes, thank you, Erin. And thank you, Lisa, for doing the interviewing.
Yes, thank you, Lisa.
Absolutely. It's great learning and I love connecting with everybody. I mean, we're all from the healthcare area, so it's nice to be with like-minded folks. So.
And the newbies here, I'm always on the lookout for people like Lisa who loves interviewing our interviewees.
Yeah.
So, and this is just a way for me to kind of like get you exposure.
Mhm.
And not only exposure to others, but also for you to be comfortable talking to others. Because you definitely will do a lot of that when you finally get your job. So yeah, just shoot me a message if you're going to be interested. I have someone, it's Shelly Reeves for September.
Oh, she's another NP?
Yes, this August will be Steven, but I already paired him up with, I believe it's Jennifer.
Nice.
I can't remember her last name. So Shelly, I haven't found someone to pair with. So let me know if you're interested. Newbies, I'm talking to you.
Don't be shy.
Yeah.
Lori kind of had me do an interview and I was so nervous, but it was Daniel at Fast Slow Motion. And I learned so much about consulting by doing that interview. So don't be shy. And you get promoted on LinkedIn. So
Right. Yes.
Yeah, and connect with folks on here too. It's great. So for sure.
And Shelly, I would also agree. Somebody said Shelly's awesome. She is awesome. She continues to reach out to me and give me so much advice. So
All right. Well, thank you so much, everybody, for attending. Lisa, your parting words.
All right. Yeah, thanks for hanging out with us on a Friday night. I know it's a little late here, so thank you so much for joining us and for sharing your thoughts and for interacting with us. We really appreciate you attending. So hope you all have a great weekend. Thank you so much.
All right,
Have a great weekend.
Bye-bye.
Bye.